Okay, welcome to the CUNY School of Professional Studies Nursing Information webinar. This evening's webinar, we're going to focus on our undergraduate programs and talk to you a little bit about the importance of going back to school if you're a registered nurse with an associate's degree or a diploma, and why it's important to advance in your academic profession. So here at the CUNY School of Professional Studies, we have an RN to BS program. We also have accelerated RN to BS to master's programs in 3 different tracks: nursing education, nursing informatics, and nursing organizational leadership. We are fortunate to have many talented faculty working here at the CUNY School of Professional Studies. My name is Dr. Margaret Riley, and I am the academic director for the nursing programs here at the School of Professional Studies. Joining us on the call will also be one of our faculty, Dr. Eileen Shake. The wonderful thing about having an online program is that we get to have wonderful faculty from all across the country be able to join and teach with us, as Eileen does from her native North Carolina. We do have some full-time faculty, but we also have many adjunct faculty who teach with us, who are skilled in their clinical experience, and we feel that that brings a rich contribution to our program because students get to benefit from our academic educators and faculty, as well as these wonderful clinicians who are immersed in their clinical expertise, and they're able to bring that back to the classroom. So let's talk a little bit about why it's important to earn a bachelor's degree. It's helpful to enhance your professional knowledge. If you've gone through a pre-licensure program, it can be very demanding. You do lots of clinical work and you learn your tasks and skills. And now at the bachelor's level, we want you to be able to build upon that and build on the skills that you already have. For those of you that are thinking ahead, that you might want to go to graduate school, one of the first steps that you need to complete is to earn your bachelor's degree. So if you're interested in being a nurse practitioner or a nurse educator or even a nursing informaticist, you do need to have a graduate degree, and the first step is to get your bachelor's degree. Having a bachelor's degree in nursing will also enhance your employment opportunities. There are many areas of the country where you cannot get a job as an RN unless you have that bachelor's degree. And the important thing to remember is that healthcare is evolving, healthcare is changing. You don't know what healthcare will look like in 5 years, 10 years from now. And the best way for you to prepare for those changes and for the opportunities that they may present to you is to earn your bachelor's degree and be sure that you are advanced in your profession. So I'm going to turn this over to Dr. Eileen Shake now, and she's going to talk about some of the major reasons why it's important to go back to school.
Thank you, Dr. Riley. Let's discuss some of the factors behind the increased emphasis on RNs earning their BS. The Future of Nursing report that was published in 2010 by the Institute of Medicine and the Robert Wood Johnson Foundation examined the changing direction in healthcare delivery and produced a report called The Future of Nursing. There are key recommendations in this report with a strong emphasis on RNs achieving higher levels of education overall, including the BS, MS, and the doctorate. On this slide, there are some of the key recommendations listed. Nurses should practice to the full extent of their educational training. Nurses should achieve higher levels of education, with a goal being set to achieve 80% of RNs having their BS by 2020. Nurses need to be full partners in redesigning healthcare in the U.S., and nurses need to implement information infrastructure and data collection for workforce planning and policy making. In order for nurses to achieve these recommendations, it does require that they have the knowledge and a higher level of education. Now let's look at magnet status. A number of healthcare organizations around the country are seeking magnet status. The Good Housekeeping Seal of Quality Care and Excellence in Healthcare Delivery is achieving the magnet status. Magnet status emphasizes advancing the education of nurses as an approach to improving care, recognizing that nurses are on the front lines of interactions with patients, and advocating that education can help nurses develop skills to translate their ideas into best practices that impact care. The ANCC Magnet Recognition Program education standards include 100% of nurse leaders must have a BSN or MSN degree. 100% of nurse managers must have a BSN or MSN managers. So you see the leaders as well as the managers are addressed in these standards. And there's a new standard. 80% of registered nurses should be working to obtain a degree in nursing by 2020 and to have a BS and or MS degree.
Thank you, Dr. Shake.
You're welcome. And now Dr. Riley will begin.
So I'm also going to talk a lot about two more major factors why it's important to advance your education as a registered nurse. One being the Affordable Care Act. This brought about new changes in healthcare delivery, new ways that we deliver care, but also ways that we are reimbursed for care. And with that also came new roles and new opportunities for registered nurses, including leadership opportunities, avenues such as case management and health coaching, increased use of technology for care management. Maybe you've heard about population health, as well as wonderful opportunities for interprofessional care. But with that comes the need for being able to communicate and collaborate with our interprofessional colleagues. Another factor that's important, especially in the New York State area, is that we recently passed a law in our state that states that all nurses have to earn their bachelor's degree within 10 years of licensure. This affects all future nurse graduates of associate degree and diploma programs. It does not impact those who are already in a school when the law was passed. And New York State is the first in the nation to make this into a law. And the rationale is because healthcare is becoming increasingly complex, increasingly interdisciplinary, and there is a greater requirement for nurses to be able to contribute their wealth of knowledge to the healthcare table where decisions are being made. And the best way to do that and to accomplish that is to have well-educated nurses contributing. So now that we've talked about the importance of why you should go back to school, let's talk a little bit about how do you make the decision about what is an appropriate school for you to go back to. So one thing you might think about is the program offerings. If you are intent on going to get your bachelor's degree and you know that you immediately want to follow that with a master's degree, you might want to think about attending a program that provides those opportunities. So look at what's being offered. Consider the cost. While many facilities do provide tuition reimbursement, there's often limitations on that. For example, you might have to work for a year before you can qualify. You might not get 100% tuition reimbursement. You might only receive it if you're working full-time and going to school full-time, which is rather a daunting task. So consider cost. Know that the City University of New York, of which School of Professional Studies is a school in, the cost for tuition is much lower than some of the private sector. So that's something to be considered. Also look at the time it will take for you to complete the program and the location of the program. Is it a program that you will need to travel to? Is it near your work, near your home? Is it an online school? In which case, different decisions will need to be made. Time is important. So looking at how many credits will be transferred in can also mean that it will take less time for you to be able to complete the program. What is your learning style? Do you like traditional face-to-face programs? And that's wonderful if you do. That's what we are mostly accustomed to. It's what you did going to school throughout elementary, high school, and college. Or are you open to the idea of going to an online program with its advantage of a freedom of time? You don't have to travel back and forth to the class. You're not sitting in a class for 3 hours. You are taking advantage of the opportunity to create your own learning. Do know that there are different forms of online learning. We refer to them as synchronous, meaning that you have to be in the course on your computer on a particular day at a particular time, versus asynchronous, which is how we run the CUNY School of Professional Studies. That means the online classroom is open 24 hours, 7 days a week, and you are able to enter that classroom at any time that's convenient to you, whether it's 3 o'clock in the afternoon or 3 o'clock in the morning. You also need to look at, are there any on-site requirements? Some schools, even online schools, do require students to attend the school on-site for certain particular activities. At the CUNY School of Professional Studies, we do like to see our students when we have and host in-person activities, but it's not a requirement to come into the school. We do also require clinical placements. That is something that's a requirement from New York State Education Department, but those are something that can be done locally as well as within the vicinity of the school in New York City. Since all RN to BS programs are required to provide some clinical experience, usually in community health as well as in leadership, these are areas that were not addressed at the associate degree level and therefore are requirements in order to earn a bachelor's degree. You might want to ask what type of clinical placement assistance is provided. Some schools leave it completely up to the student to find their own placement, which is certainly fine. It's one option, and you are allowed to do that here at the School of Professional Studies. But we also recognize that sometimes it can be a challenge for students to find those community and leadership placements, and so we do provide assistance with that. Note that at SPS, we accept up to 90 of your undergraduate credits for transfer, and that's something to be considered because a bachelor's degree is 120 credits. So the more credits you can transfer in that apply to your degree, the more credits, the less time you will have to complete. Do know that we do accept students in both the fall and the spring. That's not true of every school. So think about that when you are making your decisions and your applications. Here at CUNY SPS, we have a major focus on cultural diversity. Our students are diverse, our city is diverse, our clinical sites are diverse. We recognize and value the importance of that cultural competence. We emphasize the nurse as the educator. We have a great focus on health teaching. That is an area of focus for your community clinical. And we also have a great model of interprofessional practice. Many of our clinical sites have students engaging with different disciplines because that is how healthcare is delivered today. We like to see how you focus on application of evidence in practice and leadership. And those are two areas that you are focused on with your capstone course. Note that we are part of the City University of New York, the largest urban university in the country. We are CUNY's online school, but we do have a physical campus here in Midtown at 119 West 31st Street in New York City. The U.S. News and World Report recently ranked CUNY SPS 16th in the nation for its best online bachelor's degrees for 2020, and that puts us in the top 5% nationwide. Know that our BS in nursing program is accredited by the Collegiate Commission on Nursing Education. So when you get a degree from CUNY, it doesn't say CUNY online, it says you received a degree from the CUNY School of Professional Studies. And CUNY is a school, a university system that's recognized across the country. Our students are working adults like you, many of them in career transition. They are people with families, and they need a degree program that fits their schedule and their life. And you will find as you take classes here, both nursing and general education, that we have people in our program from all over the world. Some of the services that we provide include an online new student orientation. In order for you to be successful in online learning, it's really important to get acclimated and to understand and how to navigate the course site, how to submit assignments, how to communicate with your fellow classmates as well as your instructor, where to get assistance when you need help. It's very important that you complete this orientation before you start classes. These orientations are typically held about 2.5 weeks before the start of classes. And we do operate as a typical CUNY. We have 15 weeks semesters in the fall and in the spring. Winter session is 3 weeks and summer session runs for 7 weeks. Everyone gets a dedicated advisor who stays with them throughout their entire time here at the school. They're a resource person to help you with program planning. There's tutoring available both online and on campus. We have some wonderful writing fellows as well as math fellows. Library is accessible online, and you also have access to all of the CUNY libraries because we are a connected university. Help desk and tech support are available to you if you need it. And we also have a career services department to help with resumes, interviews, making a social media presence, how to set up a LinkedIn profile, all strategies for you to advance your professional career. So what are some things that are unique about CUNY School of Professional Studies? One is that we admit you directly to the nursing program. When you apply here, we accept you into the nursing program. You can start nursing courses right away. Unlike some other programs where you have to complete some prerequisites and then apply to the nursing program in the school. And sometimes it happens that you don't even get into the School of Nursing. Here, if you apply and we accept you, you're accepted directly into the nursing program. You can start those nursing courses right away. In fact, we encourage and we like students to start nursing courses right away because then you become a part of our community. As we mentioned, we do offer courses in the fall and spring, which are 15-week semesters. Winter is 3 weeks and summer session is 7 weeks. We do have an in-person activity that we like students to attend if they're local. We call it our Nursing Now, which is our Nursing New Student Orientation Workshop. It's an opportunity for you to meet your new classmates as well as your faculty and the student support service team. Two new things that are especially of value here at CUNY SPS include our Petrie Nurse Scholar Program. This is a scholarship that's open to students who have graduated from a CUNY Community College nursing program. You can only apply if you've been in the school and have completed 6 credits. But if you are identified and accepted as a candidate, then it pays your tuition for the rest of the time that you're here at the school. The other wonderful scholarship program that is new to us this year is the Career Ladders Scholar Program. And this is a program that is focused on increasing the number of minority males in both nursing as well as health services administration and health information management. And this is a scholarship that you can apply for right at the beginning. As soon as you get accepted into the school, you can apply for this scholarship. And remember that the CUNY name and quality education is of great value. It's recognized, unlike some other online programs that facilities may be reluctant to hire because they don't know what the institution is about. The CUNY name is well recognized and familiar, not just in the New York area, but all across the country. Some other unique things that we have here, students work with virtual patients using a program called Chatto Health. This is what we use in our health assessment program. We also ask students to participate in a standardized patient program. And this is an activity that is part of the health assessment course. We invite students to participate in this by coming to the NYSIM Center, which is a partner facility housed in Bellevue Hospital. It's a partnership between CUNY and NYU Langone Medical Center. Students come for their standardized patient encounter as part of their health assessment course. We also have an international service learning program that is focused on our community uh, clinical. Students can opt to do a service learning trip for a 1-week session, and we've gone to places such as Haiti, Guyana, and hopefully in the future, Costa Rica as well. So what is it like to learn online? It's somewhat similar to face-to-face classes, and yet it's also different in that it's asynchronous, meaning the class is always open 24/7 while the semester is in session. You can go into that classroom whenever you choose, but do know that there is weekly work. So just as you would weekly attend your in-person class, you must weekly attend your online class. Numbers are small, between 18 to 25 students in your class. You won't go to an online class where there's 300 students in the class. We keep them small. It does require that you be actively engaged in your learning. If you're the type of person that likes to sit in the back of the classroom and not raise your hand and not contribute to the discussion, then the online classroom is not for you. Each week in the online program here at SPS, there is an expectation that you will be in your classroom and that you will allocate 8 to 10 hours of work per week in order to complete the various readings, review the assignments, watch the videos, do the discussions, etc. So there is a commitment of time that you have to make, and it has to be made consistently every week in order for you to be successful. You do have to have a computer. You can do some of the work on a tablet or a phone, but there are certain programs and activities that can only be done with a computer. So you do need a computer that's working, and you do need access to Wi-Fi that's reliable. You cannot go to an online school and expect to get your Wi-Fi from the local coffee shop. You have to have access to reliable, high-speed Wi-Fi. It's important to prioritize your activities. Students that are in the program have made a time management tip video. Feel free to watch it at some point at your leisure. And they provide strategies that help them stay organized and on top of things. It's important to have a calendar and a planner so that you can block out when it is that you're going to allocate time for reading, researching, and responding to your instructor and your classmates. We mentioned the importance of having a computer and Wi-Fi. It's also important to know where you can access and get tech help as you need it. Some student perspectives. These are all students who have passed through our program and are well on their way to their careers. These are words of wisdom from one of our previous students. Set your due dates before the day the assignment posting is due so that you give yourself some breathing room. We typically ask students to post on Thursdays and Sunday, and so making sure that you give yourself time to complete the work so that it's done by Thursday night, 11:59 p.m. You don't want to be starting an assignment at 11:30 that has to be submitted by 11:59. Don't procrastinate. Make sure that you commit yourself to the time. That's why planning is important. Life happens. We understand. You're busy, capable, responsible people. Be proactive in seeking help and informing your instructor when life events happen. You might have planned to do your work on a particular session day, and then an issue occurs. You get called into work, there's a snowstorm, whatever. Be sure that you notify your nursing instructor about your issue so that you can negotiate with them in a professional manner if there is a possibility for you to revise and submit your assignment if it's past due. Remember, your instructor can't read your mind. It's important to communicate with them. If you're feeling overwhelmed, take a breath. Just deal with the here and now. What can you get done in the next 30 minutes? What can you get done in the next hour? And always remember, you are already highly accomplished. You've already gone through a pre-licensure program and earned your license. And if you make it into the CUNY School of Professional Studies, you would already be part of a very valuable and positive professional organization here at CUNY SPS. So the learning management system that we use here at CUNY SPS, as throughout all of CUNY, is called Blackboard, and that is where your course site will live. We try to keep all of the courses in nursing fairly consistent. We have a similar menu table. We ask students to post on Thursdays and Sundays. Every day, day 1 is Monday, day 7 is Sunday. So we try to have some consistency for you. This is what a typical Nursing 301, one of your first courses, would look like, health assessment. You can see that we have weekly folders, and outside each folder is a list of tasks that need to be done that week. You need to click into the folder so that you can complete the assignments that are due that particular week. It's important that you give yourself time, take a look at what needs to be done. Make sure that you download your syllabus so that you always know what comes next. This is our curriculum. Note that there are 30 nursing credits in the RN to BS program, and that includes one 3-credit elective. Transition to Professional Nursing is the first course we ask you to take, and this is where we focus on development of your scholarly writing skills, getting familiar with APA format, which is used in scholarly writing, how to read and interpret a research article, how to apply evidence to practice, and getting familiar with navigating in the online environment. We also talk about ethics and clinical issues. Health assessment and health teaching are also part of the first year courses. You'll note that we have some courses listed in red there, and those are courses that are more than 3 credits because they also include a clinical component. So the first clinical course is community nursing, and you are required to do a 45-hour community nursing clinical. The second clinical course is our leadership and management capstone course, and that requires 90 hours of a clinical experience. And we'll talk a little bit more about that. You can take pathophysiology, chemistry, and statistics at your pre-licensure school and transfer them in. You can also take them on e-permit at another CUNY school and transfer them in if you prefer to take those in a face-to-face manner. And then you need enough general education and elective credits to meet the 120 credit requirement for a bachelor's degree. We have some elective classes in palliative care, aging, case management. If need be, you can do independent study. That's usually done for less than 3 credits. And I'll talk a little bit more about prior learning activities or PLA. This is a recommended sequence of the courses. You can see that, as we said, we like everyone to start with Nursing 300, our transition to professional nursing. And with that, you can take the program requirements, chemistry, pathophysiology, or statistics, if in fact you have not completed them. That's also a good time to take some general education courses that you may need. Or you can also take Nursing 301, health assessment, and Nursing 302, health teaching. You see that Nursing 303 is our caring for patients in their communities. That's the course that requires a clinical. We also offer Nursing 313 and Nursing 350, which is Principles of Nursing Research. Note that we do offer some of these courses in 7-week summer sessions, so you can continue to advance yourself forward in the program. Global Health and your capstone are part of your last and final semester nursing courses. For those community clinical courses, you have options. 45 hours can be completed in a few different ways. One way is that you find your own placement, which is a nice way to do it if you need a lot of flexibility. You arrange your own preceptor in a community setting. We do need to be informed of it and approve it because oftentimes the settings do require contracts for a student to be there, even if the student is an employee. And preceptors need to be bachelor's prepared RNs. The other option is asking CUNY SPS Nursing to place you, and we have a few different ways that that can be done. Note that if you're asking us for placement, then you need to be flexible because we need to be structured in order to accommodate all of the students. So we ask clinical sites, what days can you accommodate our students? They give us a schedule, and then we bring in clinical faculty to work with you on those particular days. So do know if you ask us for placement, then we will be determining what that schedule is. Most of these sites, because it's a community clinical, will be at senior centers and other community-based programs such as adult daycare programs, children's daycare programs, home care, wound care centers, ambulatory care centers, etc. Students can also opt to do a 1-week clinical immersion, again, at a community clinical site that we orchestrate. And the third option, if you ask us for placement, if it's something you're interested in doing, is to commit to the international service trip. For the capstone, this is a 90-hour requirement, and this would roughly be 1 day a week for 15 weeks over the course of the semester. This is not something that you can do in 1 week or 2 weeks because of the nature of the project. It's something that has to expand over the course of the semester. It is a change project in quality improvement. And so you need time and opportunity to get to know the population at the site in which you are doing your hours. You also need to identify what are the quality improvement issues, research them, identify strategies to use to address them, determine with your preceptor what would be the best approach in a particular setting, and then prepare a proposal that takes into account how it would be implemented, what it would cost, and what would be the outcomes. So it's an intense project that needs to unfold over a 15-week period. Preceptors and sites are available during the weekdays, so do anticipate that you will need to carve out time for this. There are no weekend options because most preceptors for this kind of a project are not available on the weekends. Again, you can self-select your own preceptor and clinical site, subject to nursing program approval, as we may need to get contracts with the agency that you seek. And we can also offer a placement assistant for this particular clinical requirement as well. Sometimes students come to me and say, well, I started the program, I live in New York City, but now I'm moving across the country. What am I going to do about my clinical placement? Well, that's certainly something we can work with you on. But since you are living in the new state, in the new place, you would need to do some of the legwork and investigation and find a facility or an agency, perhaps the agency that you work for, because students can do these projects in their place of work. And we would be happy to work with the facility and set up a contract. I do have contracts with facilities in California, in Nevada, in Pennsylvania. So these can work, but it does require your assistance and contribution as well. Let me talk a little bit about prior learning assessment. What does this mean? Well, it means that if you have earned credits from another degree or even from classes that you took at another college, you can transfer those credits in. Up to 90 academic credits can be applied. You can also opt to do credit by portfolio evaluation if you have knowledge and expertise that you've learned outside the classroom, and there's a process and format by which this is done. You can do credit by examination. Some of our students do that. They've taken history or chemistry or other general education courses, not nursing courses, but they do take those general education courses in this format that you pay outside for the exam. You study and prepare for it, but it's a lot less costly than paying for a course, and you can also do it at your own pace and timing. We also offer what we call credit for non-collegiate learning, and these are different types of formal courses or professional certifications and examinations that are taken outside of traditional degree programs and have been evaluated for college credit. So those are things that we're happy to discuss with you once you make it into the program if it's something that you want to consider. Some examples of things that we have approved include certifications for such things as a certified emergency nurse, a critical care registered nurse, a certified wound ostomy nurse, and ACLS and PALS. So information about that can be found on our undergraduate credit for prior learning website, which is included here on the slide. These are our tuition and fees for the current academic year. Note that these change usually in the fall, so it's always good to check what those are. Currently, the undergraduate tuition is $305 per credit, and it is $3,465 for full-time or 12 credits per semester. In-state tuition applies to all students regardless of where you live. This is the tuition that you would pay. And financial aid can be available depending on different programs that you may qualify for. We would recommend that you speak with the financial aid counselor in regard to that. In regard to the number of credits to take, we advise and recommend strongly to our new students to start with 6 credits, 2 classes. Get acclimated to online learning. It's different from face-to-face. It requires a commitment of time. It requires some learning of navigation of a course site. And so to get started, we do recommend that you only take 6 credits. Note that we do offer classes in winter and summer, as well as spring and fall, so you can continually move yourself forward. And once you feel comfortable with the online learning environment and know how to manage it, you can certainly increase the number of credits that you can take at one time. What's our admission criteria? You need to have a nursing diploma or an associate degree in nursing. You also need to have an unencumbered New York State RN license and registration, because we are a New York State program. And if you are going to do your clinical here, you need to have a New York State license. If you are from another state and you don't have a New York State license, but you're licensed in another state, that can be fine as long as you do your clinical in that other state, and as long as we can set up a contract with whatever agency that you want to affiliate yourself with. Remember, if you're asking us to place you, the placement will be in a New York area site, and so you would need a New York State license for that. There is a 250-word essay. Your GPA is a minimum of 3.0 for admission. It is a writing intensive program, so we do ask students, we do look for students that have a high GPA. As per usual at any school, you would need official transcripts from all the schools that you attended, not just your associate degree program in nursing. And you can apply right on our website using the Apply Now icon. For fall admission, the priority due date for applications is the first week of April, and the regular due date is the first week of June. For spring admissions, the priority due date is the first week of October, and the regular admission is the first week of December. And you can always see the updates on our website. For our program that involves the accelerated degree, this gives you both the bachelor's and the master's degree in one program. Note that if you were taking these separately, that would total 165 credits, 120 degrees for the bachelor's degree, and then 45 credits for the master's degree. If you take it as the accelerated degree, you will only need to complete 150 credits for both degrees. Note that you must complete the entire program in order to get both degrees. So that's an important thing to consider. So the options for the master's track are nursing education, nursing informatics, and nursing organizational leadership. This is a different application than the undergraduate RN to BS. So be aware that there are some different requirements. For fall admission, the regular application period is the first week of June, while spring, it's the first week of November. And now I'm going to turn it over in just a moment to have Dr. Sheikh update you on the master's core courses. This is just a template for what the accelerated BS to MS in nursing looks like. Note that the reason we are able to allow you to progress more quickly is because you're able to substitute some of the graduate level courses for the undergraduate courses. In particular, the Nursing Informatics undergraduate course is satisfied by the Advanced Nursing Informatics course. The Nursing Research course is satisfied by the Advanced Nursing Research course, and etc. So that is how we were able to move you forward. There is no specific nursing elective that you can take at the undergraduate level. We have you take the electives at the graduate level, and those would be some of the core courses that you would need to complete. So I'll have Dr. Eileen Shake talk a little bit more about the master's core courses now.
So as Dr. Riley mentioned earlier, in our master's program, we have 3 different tracks that you can choose from: the MS in Nursing Education, the MS in Nursing Informatics, and the MS in Nursing Organizational Leadership. On this slide, you see 9 core courses listed. Each of these tracks require that you take these 9 core courses, which equal 27 credits. These courses include Nursing 600, Policy and Ethics in Nursing, Nursing 601, which is Nursing Theory and Role Development, Nursing 602, Healthcare Finance and Management, Nursing 611, Advanced Practice Health Assessment, Nursing 612, Advanced Practice Pathophysiology, Nursing 613, Advanced Practice Pharmacology, and Nursing 615, Advanced Nursing Informatics, Nursing 625, Statistics for Advanced Practice Nurses, and Nursing 626, Advanced Nursing Research. Now let's look at the next slide, which shows the specific courses in each of the MS tracks. You'll note on this slide that you will have an additional 18 credits in each of these tracks. So for instance, if you choose the track MS in Nursing Education, your specialty courses will include Nursing 610, Curriculum and Program Planning, Nursing 620, Pedagogical Strategies, Nursing 630, Measurement and Evaluation, and Nursing 639, Nursing Education, your practicum project, which will be a 6-credit-hour course, and a graduate elective. It's important to note that in your practicum course, you will have clinical hours to complete. In the MS Nursing Informatics track, you will take Nursing 616, which is Decision Support and Health Info Systems. You will take Nursing 617, Systems Analysis and Design for Quality Outcomes. Nursing 618, Nursing Informatics Applications. Nursing 619, Nursing Informatics Practicum, which is a 6-credit-hour course and will include clinical hours and a graduate elective. In the MSN Nursing Organizational Leadership track, you will take Nursing 621, Managing Healthcare Disparities, Nursing 622, Quality and Safety, Strategic Planning, Nursing 623, Transformational Leadership, Nursing 649, Nursing Leadership, which is your practicum project and will be 6 credit hours. And once again, you will also have clinical hours in this course, and then the graduate elective. Admission criteria for the accelerated BS to MS includes that you have an associate degree in nursing, a GPA of 3.0 or better, an unencumbered RN license and registration. You will need to submit an admission essay. You will need 2 letters of recommendation from nurse faculty or nurse educator and current nursing supervisor. You will need your current resume and a description of your participation in an evidence-based practice project completed at school, such as a capstone course, or in your workplace. And now I'm going to turn it back over to Dr. Riley.
Thank you, Dr. Sheikh. So you can see that there are some different requirements for this application. You do need to have recommendation letters, you do need to provide a resume, and you do need to write a short overview of a capstone evidence-based project. So let's talk a little bit about that. What is meant by an evidence-based project? For some students, that may be the capstone project that they did in their undergraduate program, or it could be a focus on a quality improvement initiative that you were involved in at your facility. And some examples include implementing a new fall prevention policy or pain management or restraint policy. Questions that we're interested in having you answer is provide an overview of what the quality improvement initiative was, including references, and then tell us, how did you participate in it? How did you implement it? Did you collect data? Did you document? Did you present at a meeting of your colleagues? Did you present at a research day at your place of work? We need to see that you can describe the rationale for this particular QI project. For example, why did your institution decide to implement a new fall prevention policy? What was wrong with the policy that was already in place? Or what changes took place in the organization that triggered the drive to complete and update a new fall policy? And then tell us, what is the evidence behind the implementation of these policy, including references. So we're not looking for a 20-page paper. We're looking for, do you have a working knowledge of what a quality improvement initiative is? Do you understand evidence-based practice and the ability to apply it to a situation to make change? So that's what we're looking for. It doesn't mean that you have led the project. It can simply mean that you were part of the administration and implementation of it at your particular facility, or that it was something you focused on when you were a nursing student as your capstone quality improvement project. The application process for the accelerated as well as the RN to BS programs are on the CUNY SPS webpage. You can go to the specific program, select the undergraduate academic program that you are interested in, and then go to the Apply Now menu tab. You would click on that and set up your application using your CUNY First account if you are a prior CUNY student. And there are ways for you to reclaim and find out what your username and password are. Or if you've never been to a CUNY school, you can create a new account and move forward. This is what it would look like. Again, there is opportunities for someone who is already a CUNY student who was previously enrolled in a CUNY school to be able to start the application, because you will already have a CUNY First identity created. And for those who are not, there is a page aside for future students. And if you're not sure how to fill these out, we even include some video tutorials about how to complete the application. Note that since we are a senior college and we are an online school, you would be applying as a transfer applicant, someone who has already completed some credits. So that's important to know. You're not applying as a freshman, you're applying as a transfer applicant. And you will see on a drop-down menu that CUNY School of Professional Studies is one of the options among the other CUNY schools that offer nursing programs. So we want to conclude by saying that shift happens, and we want you to ask yourself, will you be prepared when that happens? You may not recall, those of you that are newer to nursing, but Dr. Sheikh and I can well remember the days when we had paper files that were color-coded and huge rooms where these patient files were kept. In not such a short time, we have moved completely to electronic health records for most patients and clients. It wasn't so long ago that we had clunky desktops that took up almost an entire desk. Now, most of us operate with these sleek tablets, and many of our students tell us that this is how they complete their schoolwork as well. More change is coming. Will you be ready, is our question. So if you need more information about anything that we've talked about today, please feel free to reach out to us. You can visit us at sps.cuny.edu/nursing. You can call us at 212-652-CUNY and ask about nursing. You can write to us at nursing@sps.cuny.edu. Please visit us on Facebook. And my name, again, is Dr. Margaret Riley, and I am the Academic Director for Nursing at the CUNY School of Professional Studies. There's our Facebook address, and we'll leave you with the parting words. If you have any questions, please email us at nursing@sps.cuny.edu. I'd like to thank Dr. Sheikh for her time, and thanks for our tech team here at CUNY SPS. Have a good
Thank
night.
you, Dr. Riley.